This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Hello and welcome to HealthLink, a program connecting home, community, and healthcare. My name is Carol Merton, and today I am delighted to welcome two guests from Grey Bruce Public Health. Today, Jason Weppler, the Program Manager of Oral Health, and Connie Hutchinson, Dental Hygienist, part of the Oral Health team, are here to talk to us about Oral Health Month, as well as all things good about oral health and teeth. So thank you both very, very much for being on the program. And thank you for sending me questions in advance. You've made my job so much easier. So thank you. I'm wondering first, before we get into the questions, if you'd mind just sharing briefly how long you've been with the public health unit, or it's not the health unit anymore, it's Grey Bruce Public Health. And just a little bit about yourselves before we actually get to the main question is, what is Oral Health Month? So who'd like to go first?
I can start, Carol. Thanks, first of all, for having both Connie and I. We're excited to speak to Oral Health Month and share some tips and tricks about keeping good oral health. But to start, my name's Jason Weppler. I am one of the program managers at Grey Bruce Public Health. I do oversee our oral health team as well as our health promotion team, and I've been here for a little over 15 years. My background was mostly on the health promotion side, and now I've got to dip my toes and support the dental team. So that's been exciting over the last few years.
Excellent. Connie?
Yes. I'm Connie, one of the dental hygienists at the Grey Bruce Public Health. I've been there off and on about 2.5 years, previously in private practice for a good number of years, couple decades. Just happy to be back and provide care for the public in general.
Excellent. So between both of you, you have lots of experience about teeth and oral health. This is great. So let's move on to the first question. What is Oral Health Month? Why was it decided to have an Oral Health Month? And why is it important?
Yeah, so this is an annual event, Carol, that we try to promote, and most dental organizations across the province and the country promote this as well, but really just to raise awareness of the importance of oral health. And we, as much as our work focuses on kind of the mouth and the teeth, we do recognize that oral health is really important for overall, both physical and mental health, because if you don't have good oral health, it can lead to a lot of illnesses and diseases, especially later in life. So we certainly encourage everyone of all ages, right from your first year of life, right through your senior years, to try and maintain good oral health. And I know Connie will get into that in a little bit. What are some things you can do to maintain good oral health? But that's really why we try and promote this month publicly.
And oral health is more than just cavities. It's about the diagnosis, treatment of oral diseases, including cavities, gum disease, jaw problems, and oral cancer.
So it really is quite a package of care and yes, that you actually do. So that's, and I'll certainly have some questions as we move forward around that. For both of you, during COVID-19, people perhaps, we've heard that people were not able to attend for appointments or have care they normally would have. And although this wasn't one of your questions, have you seen any difference from those people now that are receiving care as a result of COVID-19? Or is it pretty much what you've seen in the past?
I would say certainly, Carol, in the school setting. So Connie and our other dental hygienists go into the schools and do screenings with select grades in the schools. And I think coming out of the pandemic, we did see some worsening in some of the oral health care and some of the students in the schools, recognizing that they maybe couldn't see their dentist for a couple years during the pandemic period. So there was a brief time when we were back in doing school screenings right after the pandemic that we did see some more urgent cases. So we certainly tried to refer those families to their dentists and get them back on that regular routine, which they unfortunately had gotten out of during the pandemic for circumstances outside of their control. So certainly with the students, we saw that. Connie, I'll maybe let you speak to some of the seniors and other clients we'd see in our clinics.
Yeah, more on the clinical aspect, you would see when people have been away for a while, then perhaps they haven't got that preventative maintenance that they need, resulting in more inflammation with the tissues and possibly an increase in the decay rates as well, just because of issues with food trapping, debris. So yeah, it definitely had a toll there.
So even more important that we focus on oral health and especially Profile Oral Health Month for sure. So what are some steps? Help me understand what some steps would be that I need to take care of to make sure that I have good oral health.
Well, for sure you want to be brushing 2 times a day. So that's for 2 minutes at morning and at bedtime. You want to floss daily. You want to regularly see your dentist or dental hygienist. You want to, if you're into sports, you want to have some sports equipment that has protections for the face, such as helmets with face shields or mouth guards. We encourage that the first visit be within the first year as well.
Okay.
And then in general, when it comes to your diet, you want to make sure that you drink more water because it has 0 sugar. Because it's often very surprising how much sugar is in the drinks that we choose. For example, juice has between 5 to 6 teaspoons of sugar in it, and it can range right up to like iced teas and lemonades having like up to 17 teaspoons of sugar in it. So yeah, it really makes you want to, as our campaign says, rethink your drink.
And we think of juices as healthy, right? It's if you're going to choose between maybe a soda pop or a juice, we would think juice is healthy. But I'm hearing you say better rethink that. It may not be as healthy as you might assume because of the sugar.
That's right.
That's a big message to get out there for sure. So water is best when you think of it. Ah, very good. So that's one tip I'm going to take away today. That's for sure. So twice a day brushing for 2 minutes. So how do I need to set a timer? Do I sing to myself? How will I know 2 minutes? That sounds like a long time.
Some people suggest the singing happy birthday song in your head 2 times, saying your ABCs in your head. Some of the electric toothbrushes will have actual timers on them that stop after 2 minutes. So there's little cues there as well. Even a simple egg timer is another way that you can track how long you're doing it for.
Yeah.
We often think we're doing 2 minutes, but it's really like 30 seconds.
I think maybe. So people who have sensitive teeth, what would you recommend? Because there are people who have some challenges with sensitivity. How can you help them maintain their oral health? What helpful hints do you have?
Definitely, if you're finding some sensitivity, seeing your dentist as well, because there might be a cause for that sensitivity. But if it's just particularly foods or brushing, then you might want to try some sensitive type toothpaste. Some people need to use it for a couple of weeks before they'll notice a difference. Some people will use it and then actually kind of leave it on the tooth surface to help strengthen or coat the weaker surface of the teeth. But I definitely encourage a dental visit to make sure there isn't some underlying issues going on.
So you're in the school system, are you, Connie, as well? Are you one of the hygienists?
Actually, I'm more on the clinical side of the program.
So for the hygienists who see there are issues, do you automatically refer someone to a dentist? Like, would it be an automatic you need to see, or how does
You
that?
mean through the school system?
Could be, yeah.
Through the school system, when they're visually screened, then a report card is sent home to the parents so that they're made aware of any dental issues.
Okay.
And also to provide information on the Healthy Smiles program so that they can contact us if they should need our services.
Okay.
With the senior program, they're actually treated right at the health unit.
We're going to get into the specifics of the programs in a minute, but I understand you're part of a team. So, Jason, you would oversee a team, right, that provides oral health. Who are the team members?
Yeah, sure, Carol. Very fortunate to oversee a great team of professional women. We have we have a few contract dentists on our staff, first of all, so they aren't permanent employees of the health unit, but typically join us 1 or 2 days a week on contract to provide some dental services there. But I do have a full team of hygienists like Connie and dental health educators who are working in our clinics and in our schools, in our building, answering calls, all those day-to-day activities that keep this program functioning well. We also do have one program assistant who kind of keeps us all organized, processes our invoices, does data entry, those types of things that we couldn't get away without. So we're a team of about 15, I think, total. We operate all across Grey Bruce, various clinics, again, visiting all the schools and offering a variety of programs to children and seniors.
So if I was to go to one of your clinics, what would I see when I walked into a clinic? How is it set up?
That would depend where you go, Carol. We have 4 clinic locations in Grey Bruce. So our main clinic is here in Owen Sound. That's our largest clinic. We have 3 operatories. We have a charting room, a reception area, reprocessing room, the full gamut like you'd see in a normal private practice, very similar. So you'd be greeted by one of our staff. They would do your medical history, ask you about any medications that might be contraindicating to any of the work that might be done. And then depending on what your needs are, you'd see either our dentist or one of our hygienists. The dentists usually do the initial exam, and then the hygienists would be doing some of the cleanings and routine maintenance work. Some of our smaller sites, like in Markdale or Wyerton, are more kind of a 1 or 2 room setup, so much smaller scale. And we lease space in community buildings for those purposes. So the Community Health Center in Markdale is where we work out of, and the Salvation Army in Wyerton is the space we use there.
Yeah. And so the clinic in Owen Sound is right in the health facility, the Grey Bruce Health facility.
It is, yes. Right downstairs, main floor. We share that space with our sexual health team, our vaccine team, and other clinical services. We do take up the bulk of the space because we do see a lot of clients every week. But yes, it's right on our main floor. If clients are coming in, they would just walk in the main doors, speak to the receptionist, and be directed to our space.
So that's the clinical side that you work in specifically, Connie. And then there's the school screening and side as well, that others would go right out to the school settings.
Right.
Yeah. So people have options on where they can actually go as far as when their employees are contracted, which is kind of nice, to have those.
It's a great variety.
So we know that there are individuals who have a challenge with the finances relating to oral care. And as we're moving through shifting sands and times where finances are a little bit tighter for a lot of people, tell me how people who either don't have a dentist or have financial challenges can access services through public health.
Yeah, the unique thing about our services, Carol, is we have specific eligibility criteria. So we really do target specific age demographics, and most of our clients are based on an income eligibility criteria. But the good part is everything we offer is free. The only thing that someone might pay for is a small co-payment if they're receiving dentures. But all of our programs otherwise are free. So any of the school screenings we do in the schools, that's a free service we provide. The report cards we send home to alert parents if there are any issues, that's all part of the program. And then our 2 primary programs are our Healthy Smiles Ontario program, which is for kids 0 to 18, again, based on family income to be eligible for that program or based on need. And then our Ontario Seniors Dental Care program, and that's for seniors who reside in the province of Ontario, are under a certain income threshold, and don't have any access to any other dental benefits. And again, we would treat them for free in our clinics.
Yeah.
in Grey
So
Bruce.
across the age spectrum, really, you provide the service.
We do certainly have a gap between the 18 to 65. That's an area we do not have funding for. So anyone who falls in that could be receiving services through Ontario Works or the Ontario Disability Support Program, or maybe have benefits through work. So yeah, definitely a gap in our care system for that age group. We do focus on the younger age spectrum and then the older end of the age spectrum.
Yeah. Now, in the information you sent, not to make you put you on the spot, but there's an acronym, I don't know what it means, and it was COHI.
Yeah, so that one is COHI.
I did read.
And that one is our Children's Oral Health Initiative. So this is a partnership agreement we have with Indigenous Services Canada, and we provide services in partnership with our 2 First Nations communities in Grey Bruce. So we visit Saugeen and Cape Croker and provide services for children under the age of 8 in those communities. So again, mostly our hygienists doing screenings, maybe putting on fluoride varnishes, and we're doing a lot of, I guess, health promotion, education, and awareness as well with those children and families in those 2 Indigenous communities. So that's a really wonderful partnership we have with that program.
And I wasn't aware you did that. I think that's excellent, just excellent. So we've talked briefly about the in-school screening program, but how many schools would you actually provide? I mean, you have staff, but sounds like there's a lot of schools.
It's a lot. Connie, do you know the exact number?
I think it's something like 87.
No way.
Yeah.
Yeah, we do all the public and private schools in Grey Bruce. So that's both the Bruce Grey Catholic District School Board, the Blue Water School Board, and the French Catholic School Board. But then in addition to that, we also visit all our Amish and Mennonite schools and do screenings with those communities as well, which again is a really nice partnership with a unique population that we're really happy to provide service to.
You know, I think that's one of the amazing services that public health provides, is that the strength is in the partnership and connecting different parts of our community together through a service like oral health. And I think that's remarkable. It certainly sets the model for other programs to be able to move forward with, for sure. Are there some consistent things, Connie, that you're seeing or hearing from your colleagues who are in the school system around what they specifically are starting to really look for, like trends that they're looking for that they've picked up, or things that you see in the clinical setting that's specific to oral health?
Specifically, it has a lot to do with maybe diets as well. So the case where there's a lot of high incidence of sugar will lead to the increased risks of decay. So that's always a concern. Fluoridation too. So there's the Owen Sound community is the one community fluoridated area where outside of the area there is probably not fluoridation in the water system. So that can be an effect as well.
Yeah, and that has a direct effect on certainly the health of the teeth.
Yeah.
I know that one of the, I'm not sure we've covered it in this program, but perhaps you'd like to address it, is the ability for children, the stigma attached to teeth that maybe aren't as healthy, and also coping with painful teeth and the ability to learn in school. So I'm wondering if you wanted to comment about the other parts besides, the physical importance of good oral health, but the social and emotional parts of having good oral health.
Well, definitely, if you're in pain, you may not be sleeping well, which can affect your concentration in schools. So infection too, it takes its toll on the body as well. So having that going on without a diagnosis or treatment is definitely going to have a physical effect.
Now, I understand that there is some information that you can share, and I'm not sure which of you will be able to do that. It might be a Jason question, I'm not sure. But there's some mention about capital clinic upgrades. in Owen Sound, Markdale, and Walkerton. Does this mean Connie gets a bigger space? What does that mean?
It does mean that Connie gets a bigger space. Yeah, with the launch of the Ontario Senior Dental Program provincially in 2019, the Ministry of Health did open up some funding applications for public health units because they knew we'd be seeing many more clients and needing to expand our services to also look at upgrading our spaces. So we did apply for some funding back in 2020, and we have made some upgrades since then. So as I mentioned earlier, in Owen Sound, we did increase the number of operatories and some of the facilities we have in our space here in this building. So we did do some renovations back in 2021, 2022. So we do have a nice new space. I think it's very welcoming. I think the clients appreciate the new clinical services and the equipment that we can offer here. We also did receive some funding to do an upgrade in the Markdale space as well. So previously it was just a small one-room operation. Now we do have a 2-room setup, so we can kind of divide our reception charting area from our operatory, so we can have multiple people working in there at the same time. And again, it's a nice bright space, again, with some nice new equipment. So I think people appreciate that. And we're currently working on upgrading our Walkerton space as well. So currently we work out of the old Durham Road location, which is a housing complex run by the county. There. So we do borrow their space once a week. But it's an interesting one, Carol, because we have all our equipment stored in a closet. We pull the chair and everything out and we have to set it all up every time and put it away every day. So this new space that we're working on, and it's currently under renovation right now, is at 200 McNabb Street. So it's a nice professional building, an open space. And we're working on those upgrades to have a two operatory permanent setup in that space. So again, it'll be a nice welcoming space. We'll be able to offer additional services, including having a dentist in that space where we aren't set up to do that in Walkerton currently. So we're really excited that opening of that new space should happen around August of this year. So getting closer, we're excited.
Oh, you'd be much happier not to have to move equipment around and chairs back and forth.
The team will be very excited that they don't have to add that every morning, show up 20 minutes early to get set up. So it's perfect.
Get set up. Yeah, for sure. So you mentioned operatories, and I'm wondering if you can tell me the types of services that are actually provided. We've mentioned briefly things, but do you pull teeth? Do you fill teeth? What do you do?
Connie,
With the seniors program. Yeah. With the seniors program, everything from cleaning, preventive, gum problems, remove teeth, fill teeth, the fillings, referrals if needed for hospital type treatment, for pain and infection. Yeah, dentures, which Jason already mentioned, there's a small copay for. So yeah, it's a real broad spectrum of services,
which is great when and people may not realize that amount of service is actually provided. How do you find providing the service? How is that working with other local dentists? I know you're contracting, but do you feel as if in the community there's an acceptance of the program, and is it filling a gap that the dentists would not be able to fill?
Yeah, I definitely think it's filling a gap. We're certainly, the clients that we see are typically the clients that wouldn't be able to afford to go to a regular dentist. So I think it's a really good partnership that we can provide this unique services, and all the other dental providers out there are seeing their own clients. And I know we're all really busy, so it's not like there isn't a lot of need out there. So I think it's a really good partnership. And I guess the one thing that we're anxiously kind of waiting to hear more details on, Carol, is the Canadian Dental Care Program. So that has been announced federally, and I know clients over a certain age can enroll for that program. Some services are free. There might be some small co-payment for that as well. So we're just waiting to kind of hear how that will align with what we offer provincially. And we should hopefully have some details on that within the next month or so. I think that's anticipated to roll out or start to roll out in May. So quickly approaching.
you might be again looking for more room for Connie.
Yeah, it's a little bit unknown now, but I do think we will certainly keep the core base of our clientele. I know we have a small wait list, so it's difficult to keep up. We get clients enrolling every week, it seems. So, and it's a service we're happy to provide. A lot of these seniors that are now enrolling in the program maybe haven't been to a dentist in many, many years for a variety of reasons. So yeah, it provides some unique challenges, but again, we're just happy to provide the services, get people out of pain, and make sure their oral health is as good as it can be.
I think it's an amazing service that you're offering. So for the viewing audience and the listening audience, if there's people who have an interest to even see if they would qualify, what would you say to them as far as accessing the service? Is there a number they should call? Is there how can they?
Yeah, definitely reaching out to us at the Grey Bruce Public Health. The number 519-376-9420, and you push option 8 to reach the dental department. And we can provide with any information on our programs, as well as applications can be sent out for the seniors program as well.
Yeah. I think it sounds as if growth is part of what you do as far as expanding the service and meeting the needs of a variety of people in our community. What haven't I asked you that you would like to share in the last minute or two of the program?
Yeah, I think we captured the main points, but you're right about the growth, Carol. I've been at public health long enough to remember back when the oral health team was just a couple hygienists who really focused just on the school screenings. And we've certainly expanded greatly to a team of 5 or 6 times that size, and just the scope of services that we can provide, and just an essential service for low-income families and seniors who otherwise I don't think would be able to visit the dentist, and to be able to get them the care they need to maintain long-term, lifelong health and not encounter these urgent emergencies is, I think, a very, very crucial service for our community.
And once people have become part of your program, then are they on a roster? They just continue for regular checkups, or how does that work?
Yeah, so each year they do our seniors program. They reapply every year based on income eligibility, and as long as they are still eligible, they would remain on our roster. We do try and see them for an initial exam and then a follow-up about 6 months later for screenings, and we would continue with that cycle as long as they're eligible. And if urgent emergencies come up, we would treat those on a more urgent basis and get them in a little quicker as well.
Well, it's an excellent program that you're offering, and I'm going to invite you to come back after the next phase of the dental program becomes in place. This is exciting news. Thank you both for being on the program today. And I want to thank our viewing audience as well for joining us here to learn more about programs, services, and resources available to you and to your family. Take care and stay safe. Thank you.
Connect with us by visiting our website or email us at comments@rogerstv.com.
Here we are in Canada, where Canada's about to celebrate our talent, our people. This moment is changing your life forever. I promise you. $1 million. This is the gateway to your dreams coming true.